Hi everyone, it's Danelle. Happy Physical Therapy Month. It's the month of October, and to celebrate, I have posted on my Facebook page an opportunity for you to get some information from me. So think about your pressing questions, knee pain, neck pain, back pain, what to do about it. And I will put together a small video, short video, just like this, and answer your questions, give you some information, and hopefully help you on your process. So to start today, we are talking about knee bursitis. So check my model out on the screen here. And to understand knee bursitis, you have to first understand what a bursa is, okay? Now, a bursa, and you can see these little glowing spots here, those are the bursas of the knee. All right, a bursa is a fluid-filled sac that's kind of like the body's natural pillow, and it's responsible for decreasing the frictional forces that happen as the knee goes through its bending and its extending or straightening. Okay, you usually find bursas in the body in high traffic or high friction situations where there's that pulley mechanism happening. For the knee, it usually is in the front of the knee or anywhere where the tendons where the tendons are located, which is where the muscle transitions into that position where it goes and inserts into the bone. All right. The knee is a very high traffic junction area. There are lots of muscles that are ending from the upper thigh, ending here, and also starting right above the knee joint and going down into the foot area. So there are actually 11 different bursas that surround the knee, starting from the front and going to the sides and also in the back. Okay. Now, if you take a look in terms of motion, and let's take a look at this specific muscle, rectus femoris, one of the biggest extensor muscles of the knee. And we look at the motion of it, you can see how as it goes through that range of motion, how there's a lot of friction happening at the front of the knee, okay? So think of how many times that your knee does this motion when you get in and out of bed, going up and down stairs. So there needs to be a little bit of a cushioning or a little bit of decreased friction as this knee goes through this range of motion, okay? That's the responsibility of the bursa, all right? So getting back to this, the way that bursitis happens, and when you talk about itis, you're looking at any sort of inflammation from a medical standpoint. So bursitis is inflammation of the bursa. And this usually is really brought on by one of two things. You either have a traumatic event, so you've hit that knee, you've kind of whacked it on something, you have an accident, whacked it at the edge of a table. I do that all the time. Or you can have an overuse repetitive injury situation where it's a situation that we describe where you're going through the same motions all the time, and that over time aggravates those tissues. Culprits of that are people that are in specific positions every day, so carpenters, plumbers, even some sort of construction workers, as in that kneeling position, putting their body weight on their knee, are really prone to this. And even athletes such as runners can also get this condition, where those bursas, as you can see, are just really inflamed and aggravated. Characteristic things that you're going to see in bursitis: swelling, inflammation, pain. You may have an inability to really bend and straighten your knee depending on the location of the bursa that's irritated. And you may also get a decrease in muscle function in those big quad muscles if you have a lot of inflammation in your knee, and a lack of stability, as not as much as you're able to do in terms of squatting, running, going up and down stairs. This is one of the conditions of the knee that physical therapy can actually really help with. And the things that we do as physical therapists, we kind of come in and we decrease your pain symptoms, we restore your range of motion, so get your full bending and straightening of the knee, and then really restore your strength and your ability to go through your daily activities, and most importantly, kind of really rectify any sort of compensations or muscle imbalances that may predispose you to this in the future. So if this is something that's bothering you, really consider giving me a call. This is something that we can really help you with. So that's knee bursitis in a pretty long second. All right, so write any comments you have below, any questions. I'm happy to answer it, and happy Physical Therapy Month, guys.